Let's start with, what is COPD?
Well, COPD is a very extensive disease. It's called COPD, as it essentially summarizes chronic obstructive pulmonary disease. It affects the lungs, so affects the breathing of the people. So people with COPD have difficulty breathing. It is not an hereditary disease, it's an acquired disease. That means it happens at adult age, and it's because of the consequences of things that we do in normal life, and we'll talk about it.
Now, tell me about your job and working with COPD patients. What do you do?
As a pulmonologist, we are typically seeing patients with COPD. Now, I have to also summarize a little bit about the COPD because some people have heard the word emphysema that represents COPD, and we'll talk about the classification. But essentially what we do is take care of patients with the disease, help them to learn how to cope with circumstances that affect them on a daily life, and also treat the disease, which is very important, as you mentioned, is treatable.
And now, how do you classify COPD?
Well, it's typically classified, as I mentioned, in the form of emphysema or chronic bronchitis.
Okay.
And they're both kind of synonymous. Synonymous in the sense that they're both portraying the same prognosis, the same treatment, but there's differences on the way COPD affects the lungs for people with emphysema or chronic bronchitis. We actually classify this disease based on severity. There's people that are mild, moderate, severe, or very severe. And that's the way we have classified lately. And that represents also the way we treat those people.